So I would like to take a moment to welcome the rest of my incredible team, whose ongoing efforts do not go unnoticed. So first off, I'd like to welcome Dr. Chioma Oru, who is our Health Justice Project Director. And alongside us, we have our parent organizer, Amilka Hudson. So like I said, if you all need to communicate with us, Amilka will be moderating the chat. So please feel free to reach out to him if you need any support. I would also, thank you. We're also grateful to have 2 American Sign Language interpreters with us today, Dustin Catt and Vern Ice, to ensure accessibility for all participants. Panelists and audience members, please remember to pause periodically.
Just hear them and then it just, I know.
Please remember to pause periodically as you speak to allow time for interpretation. Finally, I'd like to mention that we have a live binder where you can access all our resources, including one-pagers, panelist bios, and presentation slides. Chioma, can you please drop the link in the chat? Thank you. All right, well, so today's first panel, we will be talking about unpacking disability accessibility for better healthcare access. So then at 12, we will dive into a second panel from ER to early intervention, building your medical home. Each panel includes a moderated discussion followed with the audience in a Q&A portion. And we ask you to hold your questions until then. Now, it's my honor to introduce our Executive Director at AJE, Rashonda Hiley Thomas, who will be giving us some opening remarks.
I'm going to say thank you and good morning. If I can get my mute button off, this shouldn't be a challenge in 2025. Good morning, everyone. I would like to welcome you to the Health Policy Camp. I really appreciate the special chat meeting of the policy camp. I really appreciate every one of you taking your time, providing your time, your experience and expertise to this very important cause. AJE will be celebrating 30 years next year, and from its foundation, from the founders, had a strong belief that it is parents, those who with the lived experience, who should be in the forefront and helping to lead the way and make change for what is best for them, their children, their families, and their community. And it's with that foundation, AJE still operates as we branched off to generate or develop our health equity project, our health justice project, in order to ensure that all families and children, especially children with disabilities and special health care needs, have the care that they need, have the education that they need in order to be successful, whatever their life journey may bring for them or they desire to take. And so with that, I really appreciate the meeting of the moment, especially in this time where there are many forces that are coming against us. There is an article that talks about, it's an old law review article that talks about representing poor people. That was the language that was used in the 1970s about representing poor people. And one of the points that the author made in that article, especially for families who are living in poverty and experiencing other challenges, they don't have the occasional inconveniences of life, but there are constant sharp objects that families are bumping up against. And that still holds true today. Even in DC, with the many challenges and barriers that families experience, that children have with accessing education and appropriate health care in order for them to be successful. So I'm really excited about this moment. I'm really excited about the leadership from Chioma, from Daniela and Emil and the rest of the AJE team and helping to lead this effort to ensure that all DC children and families are healthy, well-educated, and successful. So again, welcome. I appreciate you being here, and I look forward to hearing the panelists and us coming up with great solutions to change DC, and then ultimately that would change the country and eventually the world. So thank you.
Thank you, Rashawn, for your words and for grounding us this morning and reminding us why we're here. So now let's dive into our first panel discussion of the day. But before we do so, I will pass it on to Chioma, as we will like to get some data for you all and feedback to see where we are all at this morning. Chioma, I'm passing it along to you.
Uh, all right, I'm unmuting myself. Please feel free to take Rashonda off the spotlight. I was trying to do that while doing this. Hard to do two things at one time. Good morning, everybody. Thank you all for being here today. And, just really grateful for Team AJE. Just a little background about AJE before I get into the poll, just to say, as Rashonda has just kind of said a lot about the times that we're in, the climates that we're in. AJE was founded in '96 by two attorneys and has been led with the spirit of justice. And so having our project be the Health Justice Project, this is a continuation of work that started around advocating for special education. So all of that to say, we have big agenda today and want to start with a couple of polls. We're going to keep polling periodically throughout the panels. So I'm going to ask the first couple at one time, and let's see here. So the first poll question here is, have you or someone in your family ever faced barriers to getting accommodations in a healthcare setting? And we have a couple of people that are saying yes, frequently. Yes, frequently is a popular one. We have a few people saying no. One says yes, occasionally. We'll wait, get a few more responses, get about 75% response. So please respond. Oh, we hit the mark. So it looks like yes, frequently is the most consistent, and we'll just share that result with you guys. All right. And so the next poll question, I'm going to turn it back to Danny, is how familiar are you with disability rights laws like ADA or Section 504? So we have majority of people are saying right now somewhat familiar, between somewhat familiar and very familiar. One person is noting heard of them but don't understand. One notes not at all. Okay, great. So thank you all for this, and we will come back with more polling periodically. And back to you, Danny.
Thank you. All right. Well, like I said, our first panel will be talking about unpacking disability accessibility for better healthcare access. So please join me in welcoming our panelists. First up, we have Lei-Sea Sky, who is the Government Relations Manager at the Mayor's Office of Deaf, Blind, and Hard of Hearing. We also have with us today Michelle Hawkins, who is the Community Liaison Specialist at the Department on Disability Services. This panel will explore the barriers people with disabilities face in healthcare settings, from communication challenges to systemic policy gaps, and how we can push for more inclusive, accessible care. Let's begin with some opening reflections on this topic. Lei-Sea or Michelle, if anyone would like to take it first.
Okay, my son is home today, so I may have my I may be muted sometimes. Okay, my name is Michelle Hawkins. I have a 30-year-old son with autism. My healthcare journey started when he was 2. He was diagnosed. He was in daycare, and the director came to me and told me that she saw some deficits in his milestones because he didn't talk the whole time he was there. So she recommended me to early intervention, and he attended Easter Seals. A psychiatrist recommended that we see a neurologist because before we went to Easter Seals, he didn't have a diagnosis. So after the neurologist looked at his EEG, he said he had autism. He said that's the way that their testing looked, and because he had seizure activity. So he said, although there was seizure activity, it didn't mean that he was going to actually have a seizure. So there were not a lot of resources then. And most of the services at that time, I didn't qualify for Medicaid because we had a 2-parent household with income. So I wasn't able, and then I wasn't able to access the Katie Beckett waiver because the services were too expensive. So with the Katie Beckett waiver, you could do spend down, but I couldn't do spend down because the services were too expensive. But I've heard that now it's different. So things have gotten better. When I tried to get ABA for him, at that time, it wasn't done in the schools. It was private pay only. So that was difficult. So what I was able to do was, it's always parents who give you information. So I met a parent who lived in Virginia. She told me that there was now I live in DC, and Children's Hospital is right down the street. This is a parent from Virginia, and she told me that the hospital was having a not webinar, a class for parents that had children with autism. So I went, and there were other parents there. The parents, and my son was in a private school at the time. And the parents talked about the things that he should be getting in his classroom, and he was not. So the doctor had 2 of her interns go in and do an assessment of the classroom. So they did their assessment and helped with getting his classroom like appropriate accommodations at that time. But like I said, he's 30, and at that time they did not know a lot about autism. So pretty much I had to figure out things for myself. And some of the, outside of healthcare, some of the things that he's done, people have said nobody has ever asked. So I got him an art class. And she said, well, nobody's ever asked us to work with a child that had disabilities. So some of it is thinking outside of the box and trying to do some things for yourself. So now that he's an adult, the doctors don't necessarily have the training. He has a nurse practitioner right now. She doesn't necessarily have the training, but she has the interest, and she asks me a lot of questions. So
Michelle, I'm going to pause you right there. Thank you for sharing, and we will be continuing this conversation as we ask more questions. I do want to give Lei-Sea a moment to go ahead and share her opening remarks on this topic as well.
Thank you so very much. I do want to share more about my organization for the deaf, deafblind, and hard of hearing, and that's MODHH. There is a few different paths that we take within our program on how we can actually apply for current services and things that I can share with the panel today. The first thing is SAFE, which is securing accessibility for emergencies. We partner with Homeland Security Emergency Management Agency, as well as DC Fire and Emergency Medical Services, Metropolitan Police Department, District Department of Transportation, and Office of Unified Communications. And what we do is we continue to support each other as far as providing a secure environment. We also have fostering resources for accessibility and multimodal education, which is FRAME. We partner with Early Hearing Detection and Intervention, DC Public Schools, Office of State Superintendent for Education, and the Cleric Center. And that has to come from the community through the education lens. The resources on which organization they're under depends on the communication aspects for the program. And that within itself is how we, DC government, is able to communicate about accessibility and having a backup plan. Where DC government can actually provide a commitment under the assistant mayor and for human health services. Personally, I am a deaf woman. That means I have to be very careful about accessibility and how it's provided, as well as I have 2 adult children that have disabilities as well.
Thank you. Okay. So now let's get into the first question that we have for you both today. Can you all share, how do healthcare systems unintentionally design out disabled people, not just physically, but through policies, technology, and assumptions?
I would say they don't have the knowledge. They don't have the knowledge of the disabilities. There needs to be training.
True, I agree. I think also the medical model themselves, it comes from an ableist mindset.
Mm.
From the medical models, they try to fix the issue. That's what they set their platform on, is trying to think. They don't have the diversity. Don't think of the divergencies. They don't have the different perspectives from a practitioner's perspective, and working with people with disabilities.
Yeah. Well, thank you both for sharing that. And we will definitely dive deeper, and in the future sessions that we will be having as well, speaking about that ableist mentality and how it currently affects all of the encompassing factors that are affecting the community. So I would like to follow up with asking, how do we hold people accountable? How can providers and institutions be held accountable when they fail to provide accommodations, especially for communication needs, such as ASL, plain language, augmentative and alternative communication, and interpreters?
Really, I mean, that's a common issue right now. Across the board of healthcare. They think about disabled people after the fact.
Mm.
There's a big difference between accessibility and accommodations. There's a difference between the two. And under our current legislation, it's not written for people with disabilities. It's not on the forefront of their mind.
Mm.
Like right now, we are short on resources in how to manage these issues. Like the policies. We try to run programs that have equal opportunity for everyone. Like right now, for example, they have a 5-day request for interpreters. I mean, it doesn't really work if it's something of an emergency or a last minute for an appointment or anything that's set up last minute. It's not really always feasible. We try to bridge that gap on how we allow for last minute requests for interpreters.
Thank you, Lacey, for that, because we were speaking about that as well, and just how limited funding is. And also, Michelle, I think about you. I think about how you were sharing your son being younger, resources not being out there, being able to hear about this knowledge through families, through parents, and the power lies there. Can you
Yes.
share a little bit more?
After my son transitioned from pediatrics, I didn't know where to go to find him another doctor. Let's see, did I have this? Okay. Yeah, I didn't know where to go to find another doctor. So, of course, I go to my parent pool and ask around. So we ended up at Washington Hospital Center. And that has been a great experience. The doctors have been, they may not know about the disability itself, but they're compassionate. And all the staff, they're very nice to him, because when he speaks, they know that he has a disability. And they're always very respectful and, with him, and very patient. But they do give you, because I have another son, he's dyslexic. They do give you a questionnaire after your visit. And that's a way to let them know some of the things that, like some of the accommodations or things that they're not aware of that need to be done. So for my son that's dyslexic, we never got his lab work. So they said, go into the website. But sometimes it depends. It's difficult for him to do that. So I called and asked that it be mailed to him, because I don't want to be like crippling him all the time. Some things he needs to do for himself, but I have to guide him a little bit. So I asked him to send it to him, and then we'll work on the online platform.
Thank you, Michelle. And it honestly is a little light in your story of how you were able to find a hospital providers that were and are knowledgeable, especially since at the beginning you said there are many that don't know how to work with people and youth with disabilities. So I do want to ask and pose a question. What are some common misconceptions that, and if you, to your knowledge, that healthcare providers have about disability and accessibility that need to be unlearned?
Okay, I can give some examples of some other people, because I work in intake, so I hear, a lot of stories. One parent told me she has a daughter with Down syndrome. So she wanted her daughter to have a gynecological exam. And the doctor told her she doesn't need it because she's not sexually active. Which we know doesn't make sense. And then there was another parent who had a child who was in a wheelchair. And she said when she brought him in to the office, the doctor just looked at him like he didn't know what to do with him. So I guess education and training about disabilities is key.
And Lei-Sea, I'll pass it along to you because we're curious, how does that look like and show up for the community that is deaf and hard of hearing, or also has different disabilities?
Yeah, so just one adjustment with interpreter. So I have a staff interpreter in the room with me that voices for me on a regular basis. So I'll have them continue. So I'll have the interpreters here to sign on screen, but I'll have an interpreter here with me that I work with regularly to voice for me.
Can you all hear me?
Yes, I can hear you.
Okay, great. So going back to learned habits from the medical perspective, one thing that happens often from the medical perspective is that often they would assume that deafness is a sign of inferiority or that they are less than. And so that truly is the pathological perspective that providers should not have this learned habit. They should adjust that sort of mindset. The idea is that not that deafness needs to be fixed. Language acquisition is more what we need to be focused on. And so there is a difference in the mode of communication, and that one is not less than the other. And the second piece is that lip reading is not an effective form of communication. Sorry, just one second. So the second piece is that lip reading is not a form of communication. For individuals that are reading lips, they are not proficient at reading specifically English or other spoken languages. American Sign Language does have its own syntax. And what that means is that what I'm attempting to read on someone's face is not purely English. It is more of the grammatical pieces of American Sign Language. So only 30% of spoken language is actually visible on the lips. And so that is a huge misconception that someone would be able to communicate effectively just by having them read your lips. And in addition to that, spoken languages are often a second language for many individuals that are deaf. And the third piece of this is reasonable accommodations. Often reasonable accommodations have a cost that's attached to it. And so oftentimes that needs to be built into a business plan, so it is readily available and not something that is an afterthought. So when you do provide a business plan, it should be built into the cost in order to provide reasonable accommodations for your individuals that you attend or are a part of your business. If your business is open to the public, then your access should be open to the public in kind.
Thank you, Lei-Sea and Michelle. I truly appreciate that point of, instead of trying to fix a disability, we should be trying to gain and expand more of the resources that are available. I was just making sure. Lei-Sea, were you communicating something?
Make sure that interpreters were signing when someone else was speaking. I have an interpreter here only for voicing.
Oh, okay. Got it. Thank you. Okay. So with that, let's continue in speaking about some of the strategies that could exist for advocacy. So what are the most effective strategies for advocates to push for systemic change, especially with large health systems or government-run programs, in this mindset of expanding our resources, and truly being accessible, not just providing accommodations.
I'm sorry, repeat that question.
Yes, one more time. What are the most effective strategies for advocates to push for systemic change, especially within large health systems or government-run programs?
Hmm. Well, what comes to mind is the Family Support Council. I'm not sure Rhonda's if she's on here today. But yeah, the Family Support Council, they bring issues to government agencies.
Here, Michelle.
Oh, there you are.
Yes, if I may share, hello, Daniela and everyone, good afternoon. If I could take a minute, if that's possible.
By all means, please.
Great. My name's Rhonda White, and I'm with the with Quality Trust for Individuals with Disabilities. I also am the Family and Community Engagement Liaison at Quality Trust, and I also coordinate the parent matching program called Family Ties of DC for parents of children with disabilities across the lifespan and any disability. And the other hat is the Family Support Council, where I co-chair a group of self-advocates, parents, and community leaders that are on the council as we recommend to government agencies those advise recommendations on family-centered, parent-centered supports. And I believe that's where Michelle was alluding, that the opportunity that parents can come together to give those recommendations. And we do meet on the fourth Thursday, July, we're taking off, but the fourth Thursday of every month. And so what our recent things have been, of course, has been Medicaid. We had started that before all the things started blowing up in 2025. So we have been working with HSCSN in the early days, even with Melissa Bird, you know what I'm saying, of the issues that we were seeing with Medicaid and recertification process and certification process, all of those things. And as for training, and we're working with the MPD, Metropolitan Police Department. We've met with some of the trainers, captains, police officers who do the training for them, which we're trying to help them understand that our community is not also always a crisis community, which they do a lot of training and work around crisis intervention for those with mental health disabilities, but not to say that our community does not have dual diagnosis, right? Where they may be intellectual, developmental, and a mental health disability, but there is something to be said. There's a difference of supporting a parent or a child who's eloped from their home compared to someone that might be having a mental health crisis, and how they support both communities and understand what that communication that is necessary for our community, which also speaks to doctors, right? If I could just share that, I do believe that the training starts when they're in school. When they're going to get the PhD, there needs to be a curriculum for, knowing how to work with our community just as much as the are those of older age. Those two areas, if you look at, I'm in the sandwich generation where I had a parent with Alzheimer's, as well as I have a child with multiple support needs. So understanding and seeing how there's a lot of misconceptions and the lack of really looking at the person and not just looking at what the potential medical issue is, but remembering this is a human, this is a person, and you cannot compare them to another person. You need to find out who they are, what they are able to do, and how you support them to do what they're able to do. So thank you for the space.
Thank you, Rhonda, and for giving us that beautiful insight today and dropping some gems for us. I truly do appreciate you naming the advocacy behind parents, the power that they have there, but also the education component in holding people accountable and being trained and preparing for that, if that is the career that they want to explore. But more importantly, going into these careers, being mindful of all people and serving all people with true accessibility. Shout out to Amy Allen putting in the chat that she doesn't claim to know anything. Claim to know everything, but it's that educational component that takes us to future steps for accessibility. So I will like to wrap up, but before I would like to wrap up, Lei-Sea or Michelle, would you like to add anything to close off the panel before we go into questions and answers from the audience?
No. It's a great discussion.
Thank you, Michelle.
I would agree. This was a really valuable discussion.
This is a
So
great
I really
discussion.
appreciated this panel that we had today.
Thank you. Thank you, Vern, too. Okay. So before we go into the questions and answers portion, we just want to do one more poll, so I'll pass it back to Chioma.
All right. Okay. So thank you so much. And thank you, Rhonda, for sharing about the Family Support Council. I am proudly part of the Family Support Council, a voting member of that council. And so happy to have you share a resource that I've personally benefited from. Let me see here. So we have two questions, so please indulge us right now. And the first question here, I'm going to post question number 3. It says results are being shared. I may need to share it out. Give me 1 second, having technology issues. Okay, so let's just go to question 4. I don't think it's gonna, Oh, I see. I'm still sharing the past one. Sorry. Pause. Here is the first question. Here we go. Hope you can see this now. So it says, what do you think is the biggest barrier to healthcare accessibility? Please take your time to answer. We try to get to 75% response rate before clicking on. We have a couple of people that say lack of knowledge about patient rights is popular. We have also discrimination or assumptions, about 3 people. Assumptions about disability. We have cost or insurance as a popular choice. Communication and language barriers. Okay, if we can get a couple more responses, we're at 69%. So a few more people, please chime in. Well, it looks like we're almost there. 73%. Maybe one more person can get us to our 75%. Okay, well, we're going to end this poll and share the results. We have a tie between discrimination or assumptions about disability and lack of knowledge about patient rights as the most popular choices. And one more poll for now. And that is, do you currently have, oh, sorry, it's the wrong question. But please go ahead and answer it. It's the wrong question, and we'll ask the other one later. But do you currently have a medical home or consistent care for your child? This is a teaser for the next panel that we have coming up. All right, we're at 26%, 30%. trying to get to 75%. So please, please help us with answering these polls. They do inform our work moving forward and help us understand better where you are at. We're at 47%, so please answer more. Most popular responses are tied between yes, and it's working well, and yes, but it's hard to access. So yes, with some quality issues, it looks like. Okay, and we may end up repopulating this poll when it's more appropriate, but just share this and I'll pass it back to you, Danny.
Thank you, Chioma. I know I've been moderating, so I haven't really looked into the chat, but as I am just briefly tapping into there, I just really appreciate all of the conversation that is happening right there, and especially behind sexual justice and being able to know the background and also, most importantly, how we shouldn't be excluding someone for care, healthcare specifically, because of their disabilities and different prejudices that exist for not tapping into that and taking care of them as the whole person that they are. So let's go ahead and do we have any questions and answers? Maybe we want to take more of that conversation that was happening in the chat. If anyone would like to come off mute and ask any questions.
Hi, this is Dr. Vantaboo. Can you hear me? Fantastic. Good morning, everyone. So I was just chatting away in the box here, and I've been a provider for HSCSN for some many years. And I've noticed a decline in the patients that I have been seeing. And I believe I can only assert this to there being a gap in the caseworker and or others knowing what services are out there by other providers to be able to provide neurological evaluations for these people, these children in this population group. And so one of the things I was trying to do was to set up a meeting with the caseworkers and even the families to find out what their needs were regarding evaluations and exams. I'm a chiropractor by trade for 27 years, and our specialty is the nervous system. And so when you have children that are hyperactive and or autistic, a lot of times their nervous system can be just really going haywire, literally. And so certain evaluations and or treatments may support with the structure and functionality of how these children and or caregivers operate, because the parents are stressed, everyone's stressed, and it's not easy caring for loved ones who have needs. And so I propose and just wanted to bring out to the group that our services are available. We are happy to come in, speak with caseworkers and or advocate how if services aren't covered by Medicaid or other outside entities, how payment can be rendered for the provider to be able to provide these services. Because again, if the parents are stressed out or have other psychological needs or behavior needs, then there may be a way we can support the whole system in making sure that they have what they need. And so let me just give you an instance. When I went to a home, we do a holistic approach. So we go to the home, we observe the parents, the environment. We went to the schools, observed the child in school, as well as spoke to the counselors and the whole team that was involved in the child's education process. I had a 1.5-year-old child that I evaluated. She had been repeatedly molested by someone. The mother had obviously a behavior issue, and the home was not the best environment. So the child was completely despondent, could not function in school at all. She was literally just sitting there like a blank slate. And so these children have a lot of trauma. And so again, if there's no one able to diagnose these children or just pass them off as just ADHD or whatever the diagnosis may be, and they have no support to help support the child in recovery and helping them to get better, then where does that leave the parent, the child, and the system? So again, we don't only want to just do the evaluations and let them go, but the IEP needs to reflect exactly the resources that are necessary and needed for that child to thrive. So those are the things that we did to really help support the community and this population group. So again, we're here if you need support and or if you need to reach out to us for other services. I'm happy to speak to the people here. So thank you.
Thank you, Dr. Vanderpool, and we appreciate you sharing. It was a pleasure meeting you at the Ward 8 Health Council meeting. So definitely looking forward to that partnership together. And please drop your information if you can so that people can reach out to you if they would like to.
Sure, likewise. Now, I'm in my workout clothes right now. That's why I'm not visible to you guys, but I just wanted to make that known to you guys. So thank you.
No, thank you. It's okay. It is a Friday. You're getting your exercise in. We love it. So now, before we transition to our next panel, I do want to thank everyone, especially our panelists, Lei-Sea Sky and Michelle Hawkins. Thank you so much for this conversation and for contributing with us. So we will be taking a 5-minute break, and then we will be coming back shortly for our second panel. So please take care of yourselves, and we'll see you soon.
Thank you so much.
Thank you. See you, Lei-Sea. Okay. So we're going to go ahead and get started. We are still awaiting one of our panelists, but hopefully they're able to make it. Emil is checking in with her right now, so we will keep you all updated. In the meantime, I would like to welcome everyone back. And for our second panel, we will be diving into the concept of a medical home. We'll learn why too many families are forced to rely on the emergency room instead of consistent, coordinated care. We'll end the second half of the panel with what it takes to build consistent, team-based care for children with disabilities. Before I welcome the panelists, I would like to pass it on to Chioma to just ask you a couple of questions and again, get a little bit gauge of the room on this topic.
All right. Okay. Good morning, everybody, again. And I have 2 more questions. One is from the previous panel that I misplaced where I put the question. So I'm going to start with that, and then I'll go to the other preliminary question to this poll. And if I can, I'll try and relaunch the one that I did before so we get better numbers on that. But here we go. So this is from the last panel, so just a few minutes ago, refreshing your memories. Do you feel empowered to request accommodations for yourself or your child in a medical setting after our panel? Start with, we have enthusiastic yeses. We have about 6 yeses, 41% response. Remember, our goal is to get to 75%. So we'd love at least half attendees, well, more than half, a little more than half attendees to please complete these polls. We're 52, just a few more, please. And we are strong on the yes. We have 8 and 1 somewhat. Okay. I will go ahead and end the poll in the interest of time, even though we are 55. And let me go quickly to try and relaunch this other one. So let's get get different numbers here on do you currently have a medical home or a consistent care team for your child? Okay, so we have, again, 1 yes, 2 yeses, yes, and it works well. The responses are trickling in, yes, but it's hard to access. So I hope those are new people. And we more yeses and it works well. So I'm going, 1, not sure what a medical home is. Thank you for that transparency. So that's great. So one more question for now, which is, what makes it hard for your family to get consistent health care? Is it hard to get appointments? Are there no providers that understand our needs, insurance or cost issues, language or transportation barriers, or something else? And if there is something else, please drop it in the chat. Give me 1, drop it in the chat. So it looks like we have majority of our responses so far at 55% are on hard to get an appointment. And no provider that understands our needs. I'm going to share, I'm going to end this poll and share these results. And I'm going to pass it back to you, Danny.
Thank you, Chioma. Really appreciate it. All right. So without further ado, I'm going to go ahead and introduce our panelists for our second panel, which we will be talking about building your medical home. Before I proceed, again, for those people who just joined us, I would like to point out that today we have Vern and Dustin joining us with interpreting. And let's go ahead and introduce our panelists. So first up, we have Gail Avent, who is the Executive Director and founder of Total Family Care Coalition. And with us today, we also have Kate Detwiler. Kate, is it Detwiler or is it? Yes, good, thank you. Kate Detwiler, Program Manager for the Complex Care Program at the Children's National Goldberg Center at Pediatrics and Community Health. So we'll start with some opening reflections on this topic. Kate, would you like to start?
Well, thank you very much for inviting me and the Complex Care Program and Children's National Primary Care to participate. I am the program manager for our Complex Care Program, and we provide a primary care medical home for children with medical complexity and their well siblings. And so we are embedded within a larger primary care practice that has locations across Washington, D.C., that also provides primary care medical homes for folks in the community. I'm also the parent of a child with medical complexity myself, and I'm a Maryland resident. So I personally have navigated some of this, and I work in this space. My contributions will be from the lens of the health system, but I also am happy to contribute personal reflections if that would be helpful.
Thank you, Kate. Now I'll pass it along to Gail.
Thank you. And thank you, AJE, for hosting this wonderful and very important discussion. So my name is Gail Avent. I am the founder and director of a family-run organization. And like so many of the panel and the parents who spoke before, it came from a personal need. I have a son that have mental health and substance use. My son was diagnosed early on, and I did not know how, I was, not well averse, not even understanding what mental health meant and how it looked in families. And as a parent, definitely did not have the skill or the knowledge to understand how to parent a child. So it became a quest for me, for a personal quest to understand the knowledge and what I had to do different, if anything, to parent a child that had a mental health disorder and diagnosis. And so I did, like I heard Miss another parent said, you listen to other parents, find out what they doing, and you try to get some information. So doing my quest and running around DC, not knowing what to do. My son was getting put out of school. He was running away. And seemed like people didn't want to help a parent. He had a bad child. He wasn't bad to me. He had a mental health diagnosis. And so I stumbled upon a committee at Department of Behavioral Health called System of Care. And that's where I really began to learn about mental health diagnosis, how parent can tailor their parenting style to meet the child's need. And so it later became where I said, I'm going to help other people. And I created and founded a 501c nonprofit family-run organization for parents to come to get information about their mental health, their mental well-being, and the children understanding of what their behavior are, and so that they can be seen as a benefit, not the problem. But parents always want to be champion for their children. And, we get a little territorial when you're talking about our children, but you're not helping us. So now, I'm an advocate on a lot of levels, and I appreciate coming in this space today, because advocacy is how you can make a difference as a parent. So thank you.
Thank you both for coming to this conversation, being here. We really appreciate you both. And also for sharing the work that you do, but also the little personal note of working with families and also from your family. So with that being said, let's start the conversation with discussing why are so many families, especially those children with disabilities, relying on the ER instead of consistent primary care provider. I'll pass it to Gail.
Well, for me, my reason was going to emergency room because I didn't know about community resources. I didn't know that there was providers in the community that work with youth. I didn't know that. So the emergency room was how I could get some quick answers, get in quick. I didn't have to worry about waiting months for an appointment. And hopefully it was going to provide me with some resources and understanding, and my son some understanding about what was driving his behavior. So that's why we was going frequency to the emergency room. But over the years, and with the help of community partners, Children's Hospital is one of my partners. Medicaid is a partner of mine, HSCSN. So it was like gathering a lot of information to be able to offer to other parents to say there's a better way than just going to emergency room. And oftentimes being frustrated because the child was coming back home with no resources or no community linkage to resources in the community.
Yeah, I can't, Gail said it perfectly, right? It's a combination of many factors. Some of it, can just be a lack of knowledge of community resources. Some of it can be desperation. Some of it can be a lack of available health centers to families, which is, it isn't as much of a problem in the DMV as it is in more rural areas, but it still exists. Hours of operation here at our primary care practice, we have expanded our hours for evening access and Saturday hours. But if you get sick on a Sunday, you have urgent care as an option, or you have the ED as an option. So some of it just is the infrastructure that's available. Transportation can be a challenge, right? So if you can call 911 and you can get an ambulance, but you have trouble accessing a vehicle to drive to your primary care appointment on a regular basis, some of it is just transportation and access. Some of it is we have found over the years of just families' level of comfort. For generations, they have just used the Children's National ED in particular. That's where they feel comfortable. That's where their mother got care. That's where their grandparents got care. And so that is just generational embedded behavior. And that's one of the things we've been trying to break as we have expanded access as an organization.
Thank you all for sharing that, and also the many barriers that continue to persist for having that accessible care, especially in communities who don't have that proximity and accessibility there. Now, can we transition a little bit into what are the key components of a strong medical home for a child with disabilities or special health care needs? With that, what should families look for when choosing a pediatrician or care team that can serve as a true medical home?
I can start at what parent looking for is relationship, because a lot of parents feel like we alone. I include myself in that because this is how I felt. I felt I was alone. I was the only one having the problem what I was having with my son. Nobody else could possibly relate to what was going on. But I found out I'm not alone. So when you get into a medical home, you get a team. You get a team that is learning to understand you, to understand the challenges, and maybe understand some of the triggers, because both the child can be a trigger, the parent can be a trigger. So a medical home can help identify some triggers so that it could be reduced in the community. And the aim is to keep the child in the community, not have them sent out more than 100 miles from the District of Columbia, away from their family, that compounds the trauma that they are experiencing. And if you in a medical home, a team where you go regularly, people can begin to understand how did you get there? What caused the behavior to escalate? How did it manifest so first? Was there a trauma involved? Was the child traumatized? Or is there what I call a DNA of mental health running through generations in the family? With knowledge, the parents can understand how to improve, enhance their parenting skill, because the child has behavior help, some disability, and then going to managed care plans that have a high focus on providing children service like Children's Hospital. I tell everyone that parents and children love having a relationship with pediatrician. So if that's the case, use that as a way to begin to have relationship, because parents and children are big on relationship. Because if you think about it, what relationship are they bringing in that factors into the child behavior? Is it a good relationship? Is it a bad relationship? Do they need to understand how to model a good relationship? Because maybe all they see is bad factors that are impacting their life on a daily basis. So I say, have good relation, have open communication, have understanding, and have humility. Give them a little grace. Don't turn off when you hear something that may be a little challenging, because they see that as a safe space. So if they see safe spaces, they are able to become more confident in letting you know what is really is affecting the family as a family. And I do my work as holistically as possible because I don't want to give the child more attention than giving the parent. I think it should be done together. And that's how we look for making linkages to medical homes that provide that type of focus and relationship building.
Again, Gail couldn't have said it better and more to the point. It is about the relationship. From our perspective within the hospital, you can have a medical home with your primary care, which is where my team's focus is, or you could have a specialty medical home. So if you have your child has a particular illness, and you go to see that specialist a lot, that specialist can kind of become your medical home where you can develop that relationship. You can, have that relationship over time, as Gail mentioned, so that the provider, the physician, the nurse practitioner, and the team as a whole can get to know you, get to know your child, can see them at their highs and their lows, and that can inform a lot of how their care is, how care is provided. In the primary care setting, the medical home has 5 components from a structure perspective. It includes care coordination. It includes enhanced access to care. It's family-centered, just like Gail mentioned. It's team-based care, also like Gail mentioned, and it's about high-quality care and quality improvement. And so when we, as Children's National Primary Care and the Complex Care Program in particular, are designing our medical practices and how we provide care in the community, we keep those 5 things in mind in particular, if that's helpful.
No, that's very helpful. And thank you for providing that background to what a medical home consists of and what those components are. I do want to shift the focus a little bit and speak about the systems that exist and currently the political climate that we're in and many of the threats and barriers that are going to continue to persist. So I ask you both, how can systems ensure that families of color, immigrant families, and families with limited financial resources can still access consistent, high-quality care? And I'll pass it to Gail.
Thank you. Kate, I'm not trying to overtake the lead,
Go for
but
it,
thank you. I just want to do a check-in. But there is challenging because of the leadership that we have in the city and the leadership we have in this country. But I'm always hopeful that we're going to find a way, because that's what parents do. We find a way to make it through a lot of challenges. And that's what I did. I found a way to get through some of the barriers of first not understanding, getting knowledge, trying to see what services are offered in this city, and then becoming a partner with them. And like I say, for most people, most families in this city, they're in an uncertain state of how much services they're going to get from Medicare, Medicaid. Are their children going to receive mental health services, disability services in school? I was hearing about the first poll about the 504 plan. That is a great concern about parents. What kind of education is my child going to get? Because we all as parents want our children to be successful, productive members of society and live out their dreams and aspirations. But here, when it comes to parents who have children who have special needs, we know that we work with our children and teach them to have short-term goals, long-term goals, and to say, your success or your future could be on that trajectory, but it can look different. So when you have a child with special need, anytime that I said, when I was working with a parent, a child, and they were coming in and they was walking, that is a success. So we celebrate small components of going to the doctor, understanding your mental health, getting parents to understand their mental wellness. And those things really don't have to come with a price tag. So we look for what the community can do. We also become advocates for city council and legislators and organizations like Department of Behavioral Health, because they are the organization in their city that is responsible for all children mental health in their city. Not only the children, but for the individual, families and individuals who have mental health. So we talk to them, we become attached to them, we get into their arena and have on a council, we on the behavioral health council, we on school-based mental health council, we even hold meetings amongst ourselves. We testify at city council. So the real challenge, where the real benefits can come from making policy changes, lending your voice to what policies will help your family or help the community, getting the community to understand parents are people too. We're not rocket scientists. We didn't come with a book to say this is how you do parenting. We come with a heart, desire to bestow love on our children. And that's what we do. And, even when there is someone saying something that's not positive about our children, that get our attention. And we want to become a partner. The best way is look for the things that are tangible in the community, in our lives, that we can do free, that don't cost any money. Just saying nice words to a person when you meet them, maybe all they need. So it's not what we want for them, but what is it they need?
I mean, Gail, we should just give you the podium for the next 30 minutes because you're nailing it all. Gail's absolutely, right, looking at community resources. I have my response is in two pieces. One, I want everybody to know that at least from the organizations and the providers that I work with, everybody is focused on caring for kids in Washington, D.C. and Maryland and Virginia suburbs, right? Our providers, they care a lot about their patients, our social workers, everybody that works in children's healthcare cares a lot about the community and the children that we serve. Does that mean that the care is perfect? No, but know that we're trying to work together. That's true of Children's National. That's true of HSCSN. My advice going into this kind of new space is to use the resources that you have, because when they go away, if you don't use them, they go away. And a lot of things are driven by metrics and numbers. And so if, for example, if you're an HSCSN enrollee, make sure you talk to your HSCSN case manager. Make sure you return their phone calls. Make sure you call them. Make sure you fill out their forms. If you're a Children's National patient and you come to us for primary care, fill out the forms that assess your any needs you have around housing or food, because all of that data gets reported up. And if you don't come to the appointment, or you don't call back your case manager, or you don't leverage the resources, then they go away, because the organization's leadership says that these aren't resources that are needed by the community. And so when we're talking about systems change, you want to use what we already have. We want to protect what we already have access to by using it in an appropriate way. And we also, if you have the personal emotional bandwidth and time bandwidth and financial bandwidth, as Gail mentioned, look for places to advocate that resonate with you, whether that's within your community directly with a nonprofit, whether that's with an advocacy group, because Gail's absolutely right. We need to give voice to the impacts that these changes are going to make, or whether it's within, Children's National has several parent advisory boards that we're always looking for community members to participate in so that you can elevate your voice and your experience for the betterment of everybody. So those are my thoughts. Did that answer your question, Daniela?
Thank you. So I'll follow up with that as well. But I do want to give some recognition and the flowers to all the families and caregivers who are in this room speaking up, making their voice heard. Because Gail, again, you hit the nail right on the head. You truly gave a really nice background to the power in advocacy, but also in letting the council know what the community needs and what the needs are. Specifically, July 28th, you all, the council will be doing their second vote. So we will be coming out from what the budget would look like in DC. And there is still time to just go out there, be in Capitol Hill. Yesterday, we had Carol Joyner join us and shared that there will be a walking vigil during the days coming, the 24th and the 26th. It will be a 60-hour vigil to do some advocacy outside of Capitol Hill. We will share that information when we get that further along. But I did want to follow up, Kate. You shared that let's use the resources that are there. And I would like to ask and follow up with this question. If the resources are there, let's talk about also what are the gaps that continue to exist and persist. So how can Medicaid and private insurers better support the medical home model, especially in terms of care coordination and accessibility? And I'll pass it to you, Kate.
Mm-hmm. I mean, we've, CMS and Medicaid partners at the state level have looked, we've done, innovative models. We've looked at alternative payment models, right? Because that's, I hate to put a fine point on it, but it really comes down to reimbursement. And a lot of the work that is done around care coordination for children with medical complexity and children with special health care needs, and care coordination, that could mean talking to your child's school about their IEP. That can mean talking to your child's other specialists in the medical system. That could mean talking to community providers for physical therapy, occupational therapy, speech therapy, camps. All of that work is not compensated. So our providers within our practice do that in very limited time, if they can. And so recognizing that that effort is worthwhile, and that it needs to be reimbursed is really key. We've also looked at other partnership models where we can embed care coordinators within medical homes or specialty practices. And some of that work is being done. And I think we kind of have to look at what the current administration's priorities are when it comes to chronic illness, and see how we can leverage those opportunities moving forward. Because there might be some there. Some folks are actually really full in that space. So I think we always kind of have to be prepared to leverage opportunities. And that's how we create luck, right? Luck is the intersection of opportunities and preparedness. And we just kind of have to keep our eyes open and continue to use what we have, and then look for opportunities to create new value. Sorry, I know that's not an easy answer, and it's really hard to create financial change, particularly in this environment, but that's really what we're looking at.
Thank you. Well, Gail, I'll pass it back to you, especially since you are working with families, an abundance of families on an everyday basis. What do you think would be to be able to develop a more better medical home model for families?
I agree with Kate. I look at the travel. So, and I look at the wards. Ward 8 is like a healthcare desert when it comes to family. They have Cedar Hill over there now, but why is it, and that continue to be my question, why do we have to travel outside the ward to get help for our children, especially when there's an emergency. When there's a crisis in our family, you call 911. And I had nothing against the police department because I need them when I need them. But they look at children and family crisis a little different. And I used to, when we first started in 2009, we was in homes, everybody home, everybody group home, and we did all our services in the community in their setting, because that's where we learned how to build trust in their setting. So when there was a crisis, who do you think they called? They called us in addition to the police. And, usually I tell the family, I get there before the police. So don't tell them I was out there speeding all over the city. But one of the reason was because why is it that parents have to penetrate system? Why is it children have to penetrate system before we get services? We want services without penetrating system, without getting arrested, without having a long history of domestic violence. But when you break down what was the domestic violence, there was frustration between the parent and child, not knowing what they was dealing with, what was driving the behavior of the child, a frustration that the child didn't want to go to school. How do I help encourage my child to go to school? So it's a lot of things. So if we can agree to do whole health services where you are taking care of the disabilities and you're taking care of the physical health, because as the years go by, I'm learning how much physical health impact the mental health and disability. We can be safe in the community. I want people to not keep putting all these curfews in place, but trust that families can understand how to manage their families and have the children and the youth navigate in the community. Why are we becoming a police state? That's my question. Why? Why are we having system out like they have to raise our children? We know how to raise children. We know how to love them, but we do need some information and education around what is the behavior. We even need knowledge around our own self. How can we manage our own self to be good parents to our children? And what intervention services can be in our community, within our community, but having to travel outside the community and the ambulance service, if they get bogged down with a lot of critical and major violence cases, they're not going to come out for no domestic violence. Y'all arguing, well, hopefully you don't kill each other, is what they say, and then they come pick the pieces up. But to me, police should not be involved. I can understand, but families, we want families to learn how to take care of family, because we're capable of doing that. We're not bad people. We just need help. And when we try to ask for help and try to ask for the right help, sometimes we go on deaf ear. So why we can't be good listeners? So I'm a person who usually have a lot of questions. So my question to this group is, how can we come together? How can we be good listeners for each other? How can the community heal itself? Because I know it's possible. Thank you.
Gail, you led us right into the question and answer, but instead of them asking you questions, you are asking the crowd a question, and I want to hear from the crowd. So if anyone would like to come off mute and respond to Gail.
Well, I think she's 100% correct. Like I said, I work, where I work, and I've seen parents come in. They come in to get services for their child, so I know they want to help them, but they don't talk to them correctly. And it's probably because they don't know, or they're frustrated. And like she said, that can escalate the child's behavior.
Thank you, Michelle. I'm just looking at the chat. Ebony suggested let's get megaphones and go live from each of our accounts and make it a viral moment. shouting out half of the city in person isn't as effective when you're reaching families while they're cooking, cleaning, and parenting. And Gail, I think that point of mental health, families and caregivers' mental health, how much they have to take on their plate and navigate on an everyday basis, and specifically the mental health of families and caregivers of children with disabilities. I myself, my mom, I have my 30-year-old autistic sister, so I can definitely empathize and understand where that mentality of mental health taking a toll for many caregivers comes from. I also appreciate how you just named that and how we should be moving away from policing, but rather de-escalating behaviors. And everyone should be trained. Everyone. So I do want to open up to the crowd as we close out the panel. Thank you both, Kate and Gail. We really appreciate your contribution today and the bundle of knowledge that you all shared. So if anyone has any questions, any comments, I got you, Chioma. Okay.
I'd just like to offer that I've requested that the Children's National Primary Care website be added to your resource book, and that the complex care program be added as well. So for anybody on the line who is, struggling, we Children's National has care throughout the district. But if you're having any trouble, please feel free to reach out, and I'd be more than happy to connect you with services. Or help you find a pediatrician that might be a good fit for you. Children's National feels very strongly about serving the community of DC. And, it's not perfect. I know it's not perfect. My son gets care there. I know it's not perfect. But it's there. And if we can help, please let us know.
Thank you, Kate. Just make sure if you could send those along to my email, and we'll make sure to upload that.
Okay, I put them in the chat to but I can send them to you, no problem.
Yes, please. It's a lot with the chat and the screens. But no, thank you all for your patience. And so I'll just pass it back along to Chioma just to ask us a couple more poll questions.
All right. Okay, so this last time you're going to hear from me with these poll questions. Thank you all so much for participating today. I'm also posting, before I get to the poll questions, I'm posting in the chat the registration links for next week. So this is week 1 of our health policy camp. We have a whole other week. We're so grateful to our parent ambassadors who we will do much more at spotlighting and highlighting the amazing characters they have, families they have, communities that we will serve collectively as part of Team AJE. But next week continues. So for what you may not know, that we meet bi-monthly with our community health advisory panel. I'm so grateful for the professionals that have been joining us since we started convening in March. Our next CHAP meeting will be in September, on September 19th. We typically meet on between 2 and 4 on the 3rd Friday of the month. And we'll send out calendar invites for those who have indicated to us already that they're interested. If you are interested in being part of the CHAP, we ask for help. We're an interdisciplinary body. We continuously poke and prod with our polls and our questions. We also, now moving forward, now that we have our cohort of parent ambassadors, their leadership is going to be much more central to shaping the agenda and the future of the work that we do with our CHAP. But we are so grateful, and we hope that all the participants continue to stay with us. And those of us that are here that haven't been part of CHAP in the past, I'm looking at you, Mama Gail Avent. you know, Kate, look at you too. I mean, children's is strong on the chat, but bring bring more children. We can't have enough. There's so many different divisions. As the largest pediatric childcare provider, along with Mary Center, we are very grateful to be in partnership with Children's, partnership with Mary Center. So all of that, please register for next week. Next Friday, I'll just say something very quickly about next Friday, and then you can read for yourselves the descriptions. Well, I will say next Tuesday, we do have the Department of Healthcare Finance Medicaid Director, Melissa Bird, who's going to be presenting on the impact of the Big Beautiful Bill. And I think that's going to be extremely important. We also have an attorney from Legal Aid DC, Jen Jenkins, Jen Jenkins, who will be talking about Alliance, which is our immigrant insurance program for children and families, and the big changes that are coming to that as a result of the federal changes. So please tune in for that. And next Friday, we're having an in-person parent cafe. It's going to be parents only, or families only. We are going to be honoring our veteran parents, like Gail Avent, like Michelle Hawkins, and Rhonda White, and a few others, and literally giving them their flowers. Our theme is healthcare as a human right. As we continue on and growing and expanding our base, we're going to need each other more than ever. So we hope that folks register. We do require pre-registration for that, and it's going to be at the Modern and Art Place. Details will be sent out after you register, so please register if you haven't already. And to the polls, and then back to Danny. So last questions. Here we go. So what support would help you build a stronger medical home for your child? Please take the time to answer this question. Would you say a care coordinator or case manager, transportation or interpreter services, help understanding insurance, Medicaid, a provider trained in disability informed care, or all of the above? And of course, I'm not surprised. All of the above is a popular choice so far. We're 52%, 64%. Please help us get to the 75. More and more people, please add into the poll. But we have a good number. At 9, we have, yes, and we have now a provider trained in a disability informed care. Great. Thank you for getting us to our 76%. Here are the results for that. And our last poll, I will go back and share that, is after this panel, how confident are you in advocating for a medical home for your child? Are you very confident? We have some very confident. We love to see that. Somewhat confident. Still unsure. I need more resources. But what we see is that the responses so far at 52% are very confident and somewhat confident. We're going to give a pause for a few more responses here. We're glad that this has been helpful. 64%. Well, thank you all so much. And we do have one more evaluation, but I'm going to end the poll. And then, Emil, if you could please paste the overall eval in the chat when you get a chance. I'm going to share this result of our.
Give me 1 second.
Yeah. And so thank you all so much. And we will hopefully see you next week at our Tuesday panel. We do have a workshop. We encourage that to be a more discussion environment led by trainers and really centering around the leadership development of our parent ambassadors. But all parents and all community members, advocates are welcome to join the workshops. That is also in a link for next Thursday. Back to you, Danny.
Thank you. And just so that you all know, all these resources, along with the dates, like the bios and information that Chioma has just shared, is accessible through the Life Binder. So we'll drop the link in the chat again, please, if possible, so that families can access that. And then I think the evaluation survey is going your way as well. And we would really appreciate it just for feedback. We want to hear how this session, thank you. We want to know how this session went and really want to continue growing and expanding our resources for more families and sharing the knowledge. So thank you all for today's speakers, for the audience, for showing up, speaking up, and being a part of this vital conversation. Chioma went ahead and shared some final remarks with you all, but if you all have any questions, please feel free to ask. And we will stay a little bit longer for those of you who would like just a space and focus to complete the survey. But if you can complete it at a later time and you're not able to do so right now, please do so. Thank you all. It has been a pleasure.
And I just dropped the link in the chat for you all.